friends. I'm myself Dr. Shivshankar. One of my friend just who recently passed out, graduate, the young graduate, told me that, sir, practicing classical homeopathy is very difficult now, sir, when practicing compared to when practicing allopathy or modern medicine. Yes, he was right to an extent. Practicing classical homeopathy has many challenges. He is from Kerala. He also told, so in my place, in my native place, majority of our homeopathic doctors, they consult the patients in 3 to 4 minutes and they give specific drugs, mother tinctures. Now, will I be able to practice classical homeopathy in my native place? Because practicing classical homeopathy demands a thorough case taking, detailed case taking, and even patients are not habituated to give proper case taking. Generally, they will come to our clinic, tell their printing complaints. Only on that we have to prescribe. So he was in dilemma. What shall I do? I have an answer for his question. Yes, the beauty of modern medicine is, allopathy is, once the diagnosis is done, treatment is already there. They listen to the patient printing complaints, they do relevant examination or relevant investigations. Once they diagnose the disease, if you are suffering from hyperacidity or aseptic disorders, a group of drugs are already there. If they diagnose the patient that he is suffering from migraine or he is suffering from osteoarthritis or whatever, suffering from hypertension or diabetes, hypothyroidism, once the diagnosis is done well, already the treatment line is very clear because in modern medicine they treat the disease. They have specific group of remedies for specific diseases. The modern medicine could excel in treating infectious diseases with the advancement of antibiotics. They've excelled well in surgery. But however, in case of chronic diseases, modern medicine is able to only control the chronic disease, not able to cure chronic diseases like asthma, migraine, whatever the chronic diseases. Patients come to homeopathy not to get because mere relief, because already modern medicine is able to give relief. If they have pain, they have got very good painkillers. Okay. If they have fever, they have antipyretics. If they have running, we have the patient suffering from running nose, they have powerful antihistamines. Patients coming to homeopathy to get the complete relief, to get complete cure. That's why they are coming to homeopaths. What I advised him was that we have to educate our patients well. Okay. In my clinic, what I used to do is, many times patients who used to come to homeopathy for the first time, they were telling only their printing complaints that, sir, I got pain in the epigastrium, I get burning or severe erectations. Whenever I eat more, whenever I eat, it will become more, or whenever I'm hungry, it becomes more. I get flatulence, I've got constipation. Like that, they were telling only printing complaints. Once they tell their printing complaints, they were not going further ahead. I used to educate the patient. If I consider only your printing complaints and prescribe, you will get momentary relief. For time being, you will get result. If I go ahead little bit, if I understand your Sharira Prakriti, like how is your appetite, thirst, cravings, aversions, your sleep pattern, etc., and your nature, like what were the life circumstances in your life, how did you react to different circumstances, by considering your parenting complaints, your Sharira Prakriti, and your Swabhav, temperament, if I give the medicine, more chances of complete relief of your complaints, complete cure. Uh, when I used to educate them, they used to tell, sir, we are ready to give the case in detail. Please cure us completely because I'm fed up of already taking allopathic treatment. That means if we educate our patients well, okay, then they will understand. Okay, in homeopathy, there's a need for detailed, thorough case taking. They will cooperate with you, and if that patient gets cure or feels better with your treatment, you will refer other patients. his colleagues or his friends, his loved ones. Before sending, he will educate his colleagues or friends that this so and so doctor, Dr. Shivshankar, or etc., whoever is it, he takes case in detail. Okay, go with your earlier reports. Okay, go by prior appointment. Fix the time. You will take case in detail for nearly for half an hour to 1 hour, depending upon your case. If you want to get cure, you should whatever the doctor will ask, you should give the information in detail. Gradually, patient will get tuned. In my clinic, what I had done was I had practiced in taluk area, district areas as well. Now in Bangalore, I had made a pamphlet. That pamphlet was mentioning about what is homeopathy, how homeopathy treatment is done, okay, what are the details we ask in brief, so that the pamphlet is to give an outlook about homeopathic methodology of treatment, so that patients were tuned before coming to my chamber. What I mean to say, if we educate our patients, definitely they will cooperate cooperate with us to give detailed case, because every patient they want to get completely rid of their complaints. They would like to get the best possible treatment. If we assure our patients, our the outcome of the treatment depends on how we will give the case in detail. Definitely they will cooperate with you. So it is said that Sir William Osler tells the good physician treats the disease, the best physician treats the patient. In homeopathy, we aim at treating the patient, not mere